Okay, we're at 7:01 and it looks like everybody is in. And I just want to say hello, everyone. My name is Darren. I am one of the marketing coordinators with BCIT's School of Health Sciences. It is my pleasure to welcome you to the Health Sciences Information Session for the Environmental Public Health Program. I want to say how happy we are to see you all and thank you for attending our presentation this evening. And before we get started, I want to mention that the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of Squamish, Tsleil-Waututh, and Musqueam. And today we're going to go through welcome and introductions. We'll do a short poll. We'll watch an environmental public health video. We'll go through the main presentation and program overviews, and we'll have some information about program advising. And then we'll do the questions and answers at the end.
Well, hello, everybody. Thank you for coming. And my name is Dale Chen, and I'm the program head for the Environmental Public Health Program here at BCIT. We recently changed the name of our program to include the word public health rather than environmental health, because we did find that in the past, many decades now, actually, everyone always got confused because the term environmental health leads many to believe that we are sort of a environmental oriented profession or program. So you're thinking about the birds and the trees and all of that kind of stuff, and that's not quite accurate. Environmental public health is referring to the aspect of public health where the environment affects people's health. So we are thinking about the water. So where's your clean drinking water coming from? We are thinking about food. Where's your food coming from? We are thinking about air. Where's the air quality like? We're thinking about housing. We're thinking about sewage. We're thinking about everything in the environment. So if you look at it from the big picture, so public health is really divided into two aspects. One is people-to-people transmission, meaning you sneeze on someone else gets sick, someone sneezes on you, you get sick. That kind of disease transmission, people to people, that gets covered off by the public health nurses. So think of getting your childhood vaccines, going to the nurse to talk about any other diseases or illnesses, that kind of thing. That's public health nurses. But if you're concerned about environmental conditions, I'm concerned about pests, I'm concerned about mosquitoes biting me, is that a concern, etc., that kind of thing, though that falls under our program. So environmental public health, which is sort of the side of public health people often don't think about as much. So hopefully I will be able to answer a lot of your questions if you have them. Would you like to play the video, Darren?
Yeah, absolutely. I'm just going to have to change my share screen, and this will just take me a moment.
Hey, I'm Zach. I'm from Fraser Health.
Pleased to meet you. I want to show you around.
Perfect. So today, I'm doing an inspection here at this food processor. We'll be looking at making sure that sanitizers are available, that the staff are following proper hygiene practices, making sure that coolers and other cooking equipment is functioning properly. So there's a wide range of things that we are working towards to make sure that food safety and sanitation are being followed closely. So I love my job because every day is a new day. I enjoy seeing the collaboration with our health unit and seeing their successes, because when our operators are successful, we're successful.
Our environmental health program here at BCIT trains students to become environmental public health officers or inspectors. And in that capacity, we inspect water systems, restaurants, sewage disposal systems, pools and spas, and we even do tobacco control, making sure stores do not sell tobacco to minors.
I chose to come to BCIT because it is one of the few schools across Canada that offers the environmental health program. The instructors are all previous environmental health officers, and that's great because they can give us a lot of their knowledge and their experience in the field, and they make everything that we learn, they make it really applicable to the job.
Here at BCIT, we work you hard. 2 years worth of very intensive instructions, and we offer a 3-month practicum to all of our students, and so they get their training necessary to become a certified public health inspector after they're done with us.
So in the end of the day, it's about healthy communities. It makes me feel good that I've done my part. I'm a member of that community and we get to do it together. And that makes me proud to do my job to be a public health inspector.
And back to you, Dale. Thank you.
Great, thank you very much. So what is environmental public health? I've already sort of touched on it. It's the aspect of public health where it's the impact of the environment on your health. So from the video you saw Zach in a food processor, you saw him testing water, you saw him doing some other activities. So that's all covered under environmental health. So for instance, environmental health officers, they're usually the ones out there inspecting all the restaurants and grocery stores, and that's what we're most well known for. That's where everybody thinks of, oh, health inspectors, they're out there looking at the restaurants. So that is absolutely a big part of the job, especially in the city with all the restaurants we'll have. But you are also covering personal services. So think hair salons, nail salons, tattoo parlors, anything where it's a service on the body, on your body, that gets covered under environmental public health. We also cover drinking water. So for instance, if you are in a small rural community, you are on a community well, etc., that well gets inspected by the local public health inspector or environmental health officer. In the big city, again, most of it is done by specialists, so you don't see it as much. But if you are working more in a smaller community, you're covering the whole gamut. So a whole gamut of practice. We also do outbreak investigations. So for instance, if food-related outbreaks, if somebody attends a party, they get sick and it's a whole bunch of people at this wedding event, wedding reception, etc., there's often an investigation that happens. What went wrong? What food caused that illness? Is it the caterer, etc.? Those kinds of investigations are also done by environmental health officers. So it's a very broad, diverse job. Next slide, please. In swimming pools, as you can see in this picture. So we are a 2-year full-time Bachelor of Environmental Health Public Health program. So the term starts in September, sort of the traditional term start, and it ends at the end of May. So our most recent term just ended. There is a 3-month practicum at the end of your second year. And the practicums don't start all at exactly the same time, but they sort of start from anywhere from March to June sort of situation, depending on how that goes. Practicum, as well as the degree from our program, enables you to sit the certification exam to become a certified public health inspector here in Canada. And then once you get your certificate, that's what enables you to practice as a public health inspector or environmental health officer anywhere in Canada. That certificate is a Canada-wide certificate, other than Quebec, because Quebec does things a little bit differently from everywhere else, but all other provinces recognize that certificate. We are also the only program here in BC that qualifies you to sit that certification exam, and we're the only program in Canada that arranges the practicum for you. Whereas all other programs in Canada, you need to go out and find your own practicum through usually an interview process, etc. We do make those arrangements for you, so you are pretty much guaranteed a practicum if you are a student here at BCIT, and that's through our strong relationship that we have with all of the regional health authorities here in BC. that does mean you may need to go relocate to do your practicum, because if like the only spot that's available is in interior health and you have to go to Kelowna, then you may have to go to Kelowna sort of situation. But some people might want to go do that because those are often your practicum is also often tied to job opportunities afterwards, because once the employer sees you and how you work, they might want to keep you around afterwards, and that's quite common as well. So we do have small class sizes. We currently accept up to 26 students. And as in the video, all of our full-time instructors are are certified individuals and former environmental health officers, including myself. So we've all practiced in the field. We've all been through this program, actually. So we all know what the program entails, what you can expect, what are the challenges, things like that. It's a combination of going to be lectures, field trips, labs, etc. It is a full-time program, so it's going to be, especially the first term, it is in terms of workload, a solid challenge there. Some people do find that, but it is definitely doable. Again, because most students do manage to get through it, no problem, sort of thing. And next slide, please. So who would this program be good for? So first off, it says mature, practical, and assertive. And that really does go a long way. As you can imagine, if you are somebody out there going from restaurant to restaurant, facility to facility, you're always talking to people, you're always communicating with members of the public. Yeah, that skills, that self-confidence and those good judgment goes a long way in making your own life easier. You need to be able to work independently as in team and as well as in teams. So I would say 90% of the time as an environmental health officer, you're on your own. There's nobody out there looking over your shoulder. You are the one in the field going from door to door, doing your job, carrying out your duties, and you're the person on the ground making those decisions. So if you're somebody who values independence, that's huge, right? You're not stuck in an office all day long with your supervisor looking over your shoulder, wondering what you're doing. You're out there, you're arranging your own day, you're scheduling your own day, you're prioritizing what you do, etc. So that work independence is enormous. But occasionally, of course, there are projects you have to do. You do have to communicate with your colleagues. You do have to exchange ideas, all of those things. You have to work with other agencies, etc. So it's both, right? The independent work as well as the ability to work in a team when necessary. So the good interpersonal skills, communication skills, I sort of touched on that. You don't necessarily need to come in with all of these skills, but you do need to be willing to challenge yourself to work, to improve, because not all of us do come into the program with these skills, and it does take some time to develop them and to build that comfort level and that confidence. As you can imagine, not everyone is friendly. That's just a reality situation. Not everyone is happy to see their local health inspector drop in and say hi. And sometimes you have to be able to work with that and face those challenges. And everybody does eventually. It takes a little bit of time to build that confidence, to be comfortable in those situations, but everyone does get there. And then problem solving and decision making skills. That's just kind of like when you are out in the field, and like I said, you're the one making those decisions. Not everything is black and white. Sometimes you need to make a judgment call. Is this, pile of dirty dishes at the restaurant, is it a big deal or is it not a big deal? If it's a big deal, then maybe you need to take action and make them correct it. If it's not a big deal, maybe all you do is tell the owner, hey, maybe you should fix this up, because it's not a big deal, but it is something you need to look at. So being able to make those judgment calls does go a long way as well. Of course, if you're coming into the program with those skills, great. But if you don't, you will develop them over time as well. So, hey, next slide, please. So the benefits of an EHO career. So I would say the vast majority of our grads end up working for one of the regional health authorities here in BC. So I would say, Vancouver Coastal Health, Fraser Health, Island Health, Interior Health, Northern Health. Those are most of the graduates. Some graduates do work for other agencies as well, such as the CFIA, which is the Canadian Food Inspection Agency, which is a federal agency. Some people end up working as EHOs for First Nations Health Authority. Some people work as environmental health officers for Health Canada. So there's a bunch of public sector agencies that do hire health inspectors, trained health inspectors. And then there are some private sector opportunities as well. So for instance, major grocery chains often has someone in-house that helps them with their compliance issues. Big restaurant chains sometimes hire independent auditors to come in and audit their own restaurants, etc. So there are some private sector opportunities out there as well, but I would say the vast majority are public. And the good news is, especially for BC, is in the most recent round of union bargaining, health inspectors got a big raise, not just beyond the same as everybody else got, but they got reclassified, meaning they moved up to a higher salary grid. So I think they got like a 20% pay increase, basically, which is pretty good. At the end of the day, really, I think health inspectors after 5 years of service, it's over 90,000 now, if I'm not mistaken, almost 95, if I'm not mistaken. So they're doing pretty well there. Another aspect of the job is that you are working with the public and benefiting the community. You're not doing a job where it's kind of like, why am I doing this? It's sort of like, oh, I guess I'm in it for the money. But as a health inspector, especially if you work in a small community, you see the impact that you're making. The decisions you make are helping local businesses, are helping to keep the public safe, and keeping the community safe, including your own family. So you're doing a public good, right? Which is a good feeling to have. You're not in a soul-sucking job where you're kind of like, well, I'm not really benefiting on anybody other than, the bottom line sort of situation. So I personally would say that's a huge benefit. And you get to work with lots of different people. Some people actually, may not be as nice, but vast majority of people are a pleasure to work with. You get to meet different people all the time. You get to apply your science background. So I would say public health is very much an applied science. So we're not out there, thinking about theory and well, not as much. But when you're on the job, you are applying science principles. You are applying risk assessment, risk management principles to everyday situations. So if you are looking at a food item and you're trying to think, well, is this food good or not? Then you can think about what are temperatures that bacteria grow at? How long has this food been there? With my science information, can I make an educated guess as to whether or not this food is still safe, etc. So very, very much applying your science background. It's not you graduating with a science degree from a university, working as a bank teller, and never touching science again. That's not the case at all. Outside of the office, you are working outside the office. You are in the field 80-90% of the time. So you do get that freedom, which is great. You are not stuck in the office. There's some office work, there always is. You need to take some phone calls, you need to send emails, etc. But you are out and about most of the time. So if you're like a person who wants to remain active throughout the day and not stuck behind a computer, I think this is definitely a possible career for you. And then also responsibility. You as a public health inspector are empowered by the law to make decisions. You are the one on the field to make decisions in terms of what's right or wrong and what's correct and not correct. So it's actually a huge responsibility because you can really affect people's livelihoods when you're out there, because you could shut down a restaurant. That could cost a restaurant tons of money, right? You could say a water system is not safe and issue boil water advisories. Now the whole community has to boil their water, etc. So you are empowered to make decisions, and that's good because you have the discretion to make the right decision, right? You need to be confident in your own skills, and most people, I would say, sort of take that responsibility on happily because you're out there doing the most good that you can, sort of thing. Next slide, please. I touched on this already, where people end up working. It's federal, provincial, and First Nations health agencies across Canada. CFIA, Public Health Agency of Canada, Health Canada, etc., quality control and improvement for food processors and grocery stores and major chains, private consulting firms, and sometimes there are health promotion and education positions with health authorities as well. So I sort of touched on this already. I was a little bit too hasty. Next slide, please. So this was Zach again. Zach is actually, I know Zach well. He's actually left his position with Fraser Health, and he's currently working with the city of Burnaby. So I think that's a good example of another possible career trajectory. Once you are working with experience under the belt, you do become able to apply your skills and your experience in other sort of compliance and enforcement type positions. So I think Zach is currently working with City of Burnaby. I'm aware of other former health inspectors who are working with local governments as well as with other provincial agencies like Liquor and Cannabis Control Inspectors, etc. So most of these inspector type jobs carry out similar type duties, and therefore your experience as a public health inspector is very much applicable in those situations. So we need to update this particular testimonial, but that in his testimony in this case, Zach is talking about COVID. So during the pandemic, health inspectors were really challenged, right? If you remember the news and things like that, there was constantly stories about how health officers are out there doing this and doing that and things like that. And when they talk about health officers, they're talking about the graduates of this program. Environmental health officers are the only public health officers out there in any decent numbers. There are medical health officers, so physicians, so doctors, but there are very few of them. So they don't really go out there in the field making day-to-day decisions. They're looking at the big picture most of the time. So like Dr. Bonnie Henry is a public health physician. So she's out there making those big decisions, but the boots on the ground are the public health inspectors, and so the graduates of this program. So when pandemic was happening, health officers are out there obviously enforcing a lot of the public health measures that Dr. Bonnie Henry was talking about, but also a ton of contact tracing work. So they were the ones calling up people, kind of going, well, you tested positive of COVID, where have you been? Who have you talked to? What are your contact points? All of that. So that just gives you an idea. During the pandemic, your job could change quite a bit when that happened. But now, currently, all of the health inspectors are back to their routine jobs. They're no longer doing those pandemic-related positions anymore. Next slide, please.
Well, thank you, Dale. That was a lot of excellent information. You can have a bit of a break now, and I'll just go through some admissions information for everyone before we get to the Q&A. And I will be reviewing the entrance requirements and admission process, along with briefly discussing some key student services that are available to you at BCIT. So first, the important date, I believe Dale mentioned this, the start date is September, and the application period is from October 1st until the program fills. There's one intake a year for this program, and applications are accepted online each year. And it doesn't mean you should wait until closer to the start date. There's a limited amount of seats, so it's beneficial to apply early. And filling out the online application is relatively straightforward. Once the application opens for each cycle, you can log in and review the online application. You can work on filling it out and at your own pace, and it does not go to admissions until you pay the application fee. And regarding the application process, you will firstly review all entrance requirements and the application processing dates. You will then upgrade if necessary, and BCIT does offer some courses that meet some of the requirements in part-time studies, which is now flexible learning, and program advising can assist you with this. And then assure that when you apply online that you have all of your required documents, such as transcripts, ready to scan and upload as PDF files. And BCIT.ca admission can guide you through this step-by-step application process. And once you are ready to apply online, you can visit bcit.ca/apply and the application fee for domestic students is $90 Canadian and 154 Canadian for international students. And you can see the minimum academic entrance requirements. There are testing course options to meet proficiency in speaking and listening. And you can connect with advising for more information on that. Sorry, that was weird. Sorry. There's 3 credits of post-secondary English. And please note, if you completed your post-secondary outside of Canada, the US, UK, New Zealand, and Australia, you are required to complete a comprehensive evaluation of your credentials by the International Credential Evaluation Service. As mentioned, as part of the online application, you will need to upload documents for a timely assessment to be completed, and you can download official digital transcripts, or you can convert your transcripts to PDF files. And information on how to convert documents to PDF files is available on our website. For example, you can scan or take pictures of your official transcripts and save them as PDF files. And please ensure you upload all required documents to minimize delays in the application process. And after you apply, your application will be reviewed by the admissions department to ensure you fulfill. Oh, that is so weird. Don't touch that button, whatever you do. Make sure that all your entrance requirements are fulfilled, and this process can take up to 4 weeks. And entry into the program is on a first qualified basis. This means if you meet the requirements and a seat is available, you will be offered a seat. And once you are offered a seat, you will be asked to pay a commitment fee to hold your seat. And tuition for the first term will be due 60 days before the course, the start of classes, pardon me. And the commitment fee is currently $500 for domestic and $3,000 for international. There are laddering opportunities. And as you can see, there's a graduate degree at UBC. There's a SFU and opportunities in epidemiology and health promotion. Also a master's in education or a master's in global health. And now moving from academics, I would like to let you know that BCIT is committed to supporting students in a holistic sense. We want you to succeed not only in your academics, but also outside of school. Some student services are available to you as a prospective student, and others will be available once you become an enrolled student. And here's some important student supports that I'd like to mention. If you are Indigenous, BCIT's Indigenous Initiatives Department is there for you to ensure a smooth transition into your first year. They offer peer-to-peer mentorship, a welcoming gathering place, and provide clarification on Indigenous funding. BCIT's awards, scholarships, and bursaries are listed on our Financial Aids and Awards webpage. And I'd like to mention that we have a President's Entrance Award, and the selection is based on academic achievement, but also volunteer and community service. So please contact Financial Aid directly for more information about that. BCIT is committed to providing assistance to students with permanent or temporary disabilities. If you have been accepted to a program and you believe you may need accommodation to be successful, I encourage you to connect with the Accessibility Service Department. And BCIT's Student Health Services is a health clinic located on the Burnaby campus, and they provide medical care for current BCIT students all year round. We also have a counseling and student development department available to help you enhance your educational performance and maximize your success as a student at BCIT. And last but not least, our recreation services promotes, encourages, enables the practice of physical well-being, and we consider recreation an integral part of campus life and welcome all students to enjoy their services. And please don't hesitate to contact program advising if you have a question or unsure of something. They're available to answer questions regarding entrance requirements, the application process, student resources, success strategies, program schedules, and many other details as well. They're available to assist you on specific days by telephone, email, or by in-person or virtual appointments. And please go to their webpage, bcit.ca/advising, for their most up-to-date contact information and service hours. If your inquiry is time sensitive, please call them during their telephone advising hours, and this is the best option to get your question answered quickly. We would love it if you would connect with us on social media. We School of Health Sciences has a Facebook page, Twitter, Instagram, YouTube, and LinkedIn. And of course, there's a lot more interesting information on the bcit.ca website. And that brings us right to the questions and answers. So I haven't kept much of an eye on the chat, but I saw Janice has been doing a lot in there. Janice, do you know if there's any outstanding or something specifically for Dale?
We did get an initial question at the very beginning.
Okay.
And I did ask the participant to see if their questions would be answered by you, Dale, in the presentation. And they had indicated that they've got a 2-year diploma as an environmental technician from Ontario with 88 credits, and now have an admission at KPU. And I would, from my perspective, that is something that they should probably have a one-on-one discussion with program advising so that we could talk about those details a little bit, and would probably be in partnership with you, Dale, but it probably wouldn't be something we'd address this evening. But something that I thought you might be able to address was the second part of that question, which is they were really wanting to know what the weekly schedule might look like for them. So maybe you could address that part.
Yes, sure. So with the weekly schedule, you will have classes every day. So I'm looking at the draft schedule right now for this coming fall. So 2 days of the week, classes are starting at 8:30, and then the other 2 days, classes are starting at 9:30. 3 days, classes are starting at 9:30. End time is usually between 3:30 and 4:30. And you're looking at probably 4 to 6 hours of in-class time a day with that type of schedule. So it's a full schedule for sure. That's what the first term is looking like for first year. And that's fair. That's par for the course for our program, because we do have a fair amount of material to cover, unfortunately. And in terms of the earlier part of the question, I agree. He does need to. He or she, I'm not sure, does need to connect with yourself, Janice, or program advising to go through the details, because it really depends on the specific program they did in Ontario, as well as what courses they're doing at KPU. So, and before we get, I know I saw some other questions, but before we get started on them, I do want to add to Darren's admissions talk with our deadlines is we currently do have space available for this coming fall term. So if you get your application in over the next, over the summer, it does look good that we will still have a capacity to take you on at this point, which is great, because normally this time of the year, if I'm doing this info session sort of at this time of the year, I would be saying, oh, we don't really have any space, but if you would like to apply and join our wait list, please do so. But right now we do absolutely still have capacity. So I encourage anybody who's thinking of what to do during the fall and thinking seriously about taking this program, we do have capacity. So I invite you to apply. I hope that answers your question, Piyush. I'm hoping I'm pronouncing your name correctly.
There was another question where they'd indicated they were asking whether BCIT offers upgrading for post-secondary chemistry and biology. Chemistry, Dale? Do we have a chemistry? No.
Unfortunately, yeah.
No, yeah, and even the biology, I think we don't, do we?
I don't think BCIT has any courses available, because we don't offer those university level transfer courses, right? Most of our programs are industry specific or sort of program specific. So we don't really have any of those first year level, university level transfer courses. However, if you go on to our environmental public health page, under the frequently asked questions section, the FAQ, there is a link to a document of equivalent courses in some of the other institutions in BC that would transfer over. So places like Thompson Rivers, KPU, Capilano, etc., that do offer those courses. So one of those courses may work for you in terms of timing and scheduling and all of that. I would strongly encourage that person to go take a look at that list and seeing if there's something else that would work for them.
Wonderful. So Dale, somebody's asking, what kind of volunteer experience are you looking for
Right.
your program?
So it's not necessarily volunteer, but work experience as well. And we're really just looking for experience interacting with the public. So it doesn't have to be industry specific. Interacting with the public could be retail. So if you've done the cash register or customer service at a retail store, you know how to interact with the public, right? If you've worked in the office as an assistant, you know how to work in a professional environment, etc. So we're looking for positions where the person has gained some experience, either working in a professional environment or working with the public. It could be volunteer, it could be work, as long as it adds up to around one year's worth of experience equivalent. I am the one that makes those determinations. So if you're not sure, feel free to ask me and I'm happy to take a look at your resume and let you know, but that's what we're looking for. Yeah. And it's really just making sure that the person does have some experience working, interacting with the public. During my presentation, I sort of really emphasized that part of the job is definitely going out there and talking to people. And if you don't have experience doing that, it makes it much more challenging to learn. It's really hard for us to teach you. And by the time you go to your practicum, we want you at least to feel comfortable in those types of environments.
Payush is also, there's a bit of confusion regarding semesters, terms, and especially at BCIT, we call them